good death needs three things. It needs equipment, it needs medication, and it needs the staff to administer it. So in terms of equipment, a few quick questions. Do you have enough syringe drivers in the NHS to deliver medications to keep people comfortable when they're passing away?
Yes, we do. There was a challenge raised about this about 8 days ago, and we resolved. Actually, it wasn't as big a challenge as was made public, and we've resolved that. So yes, right now we do.
And the second one is with that's to the syringe drivers deliver medication, particularly things like midazolam and morphine. Do you have any precautions put in place to make sure we have enough of those medications to be delivered?
Yes. We've got a big project to make sure that those sorts of medications, as well as the ITU medications that I spoke about earlier, that the supply chains, the global supply chains for those medicines are clear. They are, in fact, those medicines are made in a relatively small number of factories around the world. So it is a delicate supply chain, and we are in contact with the whole supply chain.
And in line with that, morphine is currently prescribed per patient. The reason to do that is stop it being abused. So I have to prescribe it for Mr. Hancock. However, in this situation, if you're going into a healthcare home, you may not want to waste precious things like morphine. Have you considered relaxing the laws around morphine prescribing for doctors and healthcare professionals so that there isn't waste?
That's something that we keep under review. I've looked at that particular point to reduce wastage of key medicines, and it's something that the supply team, in the department and the clinical team talk about all the time. I don't know if that's JVT's part of the clinical team, and he may want to say more.
Thank you.
No, I've nothing really to add on that.
Okay. Thank you.
During the first national lockdown in 2020, England suffered a doubling of deaths amongst the over 75s from March to May 2020. At the same time, the use of end-of-life medicine midazolam also doubled, going from 18,000 doses a month to a peak of 38,000 doses a month in April 2020. Care homes were hit especially hard during lockdown, with 25,000 excess deaths in English care homes during April and May 2020. What I always found interesting is that as soon as the lockdown ended on the 29th of May 2020, that deaths in care homes returned to normal for the rest of 2020. Why did deaths spike during the lockdown when visitors were not permitted, and then return to normal once visitation rights for family were put back in place? The National Institute for Health and Care Excellence published NG 163 in April 2020. This centred around the rapid guidelines for managing symptoms, including the end of life for COVID-19. This document included protocols for the use of end-of-life drug midazolam with morphine for people suffering from COVID-19. A combination of midazolam and morphine together causes respiratory suppression. All of the data presented in this video is from official sources, the ONS, the NHS, and the Office for Health Improvement and Disparities. Links to all of them are included in the description to the video. Thanks for watching, guys.
Order. Welcome to this session of the House of Commons Health and Social Care Select Committee meeting. Our guests this morning are at 10:30, Matt Hancock, the Health and Social Care Secretary of State,